Good day, doctors and managing directors of hospital. So, in front of me is the demo of the hospital management software that I want to present to you. So, this is the interface, this is the logo of the individual hospital, and this is the admin login. So, the reason for this is just for me to show the features that are available in the application. So, I enter my admin username and the password, and I click sign in accordingly. So hold on while it signs in. So here we are, here we are, here we are. So now these are the features we have here. I can easily expand it so that we can see it clearly. So I will just take maybe like 2 to 3 minutes to explain this. So now we have the dashboard where we see all the OPD income, IPD income, pharmacy income, pathology income, radiology income, blood bank income, ambulance income, general income, expenses, and we see the monthly income overview. We see the number of staffs, the accountant, doctor, pharmacist, pathologist, radiologist, super admin, receptionist, and nurse. And then we see the calendar to view and the yearly income and expense graph and statistics. So now the next thing we see is billing, because definitely billing is very important. We see appointment, single module billing. We have all these things there already. We have OPD, pathology, radiology, blood issue, blood component issue. And on this flank, if you want to call it out using the case number, you can easily search out to save your time through the case ID. And let me quickly look up here. We have some other features here. The one that give us prompt us more like a bell that prompt us if anything happen, or there's a kind of transaction, or there's a calling for a patient or the other. And then we have a chat engine, meaning that we can chat within ourselves virtually. So we have calendar, and then we have our let me just say profile setup. So let's come to appointment. So let me just quickly go through it. Appointment details. This is under feature appointment. Appointment details, we have patient name, appointment number, and so on and so forth, as you could see here. For OPD, that's outpatient. For outpatient, we have all the details: name, patient ID, guardian's name, gender, phone, consulted at the last visit, and total recheck, and so on and so forth. And all these things, we can easily add patient here, and at the same time, we can download in here up to maybe like 4 formats, and then we can print the view from this platform. So the first one, we can copy, we can print or download the data in Excel. We can download still in Excel. We have 2 different formats. We have XLXX, we have a CSV format, and then we have PDF format. Everything still work with Excel, because you can easily use Excel to open PDF for format file that is having the data, and then you can print. IPD, the same thing, just like the OPD. We have all the details there, as you can see, all the details, features, and every other thing. We have pharmacy, since that's one of the department in the hospital. Bill number, case ID number, patient number, doctor name, discounts and amount, everything is records this. You can generate bill, medicine, and everything. So pathology for each of the department. So we have all the details here. We have bill number, case ID, reporting date, patient name, reference doctor, and amount paid, balance, everything. All the details are here. We have radiology bill. So we have a bill number and so on and so forth, as you can see. You can generate bill. You can check all the radiology tests here, every other thing. So blood bank, since in hospital we have blood bank, and I don't believe it's every hospital though. But we have blood bank. Like now, we have different kind of blood type and everything is categorized. And then we have blood components too. So for here we have 0 plus, A plus, and so on and so forth. And then we have blood components too that is possible, you understand, in any hospital. So we have ambulance management. You can either have your own ambulance in the hospital or you have an external ambulance. So everything can be registered, the driver name, vehicle number, and every other thing. So whatever transaction that is going on, everything will be dropping here as you transact or you communicate through the app, offline or online, depending on whether you want the application to be deployed online or offline. We have the front office, which shows visitor list, because any person cannot just breeze into the hospital without you noticing, because hospital is a place that need to be guided. Let me just say, we treasured mostly. You understand, all the phone calls and every other thing. There's a receptionist in respect to that. So there must be a record of who comes this time and who do not come that time. Birth and death record. We have birth record. This more like will be useful for our population census and for us to know our mortality rate, the number of deaths in a year or the number of deaths in a year. So it's still being used by the statistics or Bureau of Statistics. So all these things are needful. So let me just click it so that you can see birth record. So these are the things that are needed for birth record. So we have all those references, and then death record, so the same thing. So we are still moving down. We have a lot to look at. So human resources, actually the people that are working with you. So we have to manage them likely. The doctor, the admin, accountant, doctor, pharmacist, pathology, we need all their details, and receptionists and nurse. Super admin is the one that overruled the oath. So we can have staff. We will be able to monitor staff attendance. We'll be able to monitor staff payroll and their leaves. You might create your own leaves according to your own hospital and according to your institution. So everything depends on you. So referral, they might refer from different areas. So there might be commission that transcend between one institution and the other. So this is where, because if you have 100%, when a person is referenced, there may be a kind of breakdown in the percentage. So that's the reason for this aspect. So let me try and scroll down. We have TPA management, that's third party administration management, like the HMOs. You understand, we must be able to know their code, their name, their phone number, address, contact person. So everything has to be registered here, so that while we are attending to the patients, some are attached to some various HMO as a result of a discount. So finance, we have finance, income, and expenses. Let's check. If you want to check your income per month, per year, you can easily check everything here and download it accordingly, as I said. So let's try and drag down and go to expenses. The same thing. If you want to check your expenses, so you'll be able to know your growth, how your growth is scaled per time. So messaging, we have messaging too, where we can check notice board, that is maybe the MD post a particular meeting schedule, and then everybody has to see it on their system. They will be seated in their various offices and they will be able to see whoever is on duty for that day, and they can respond to it. So we have post new message, send SMS, send email. So whoever is let me just say, has that responsibility, we do so. Inventory, we have to take inventory because of the management of stocks that we have in the hospital, like the drugs and every other things like that, okay, syringe and many other things that we have to sell. So name, category, supplier, store, date, description, total quantity, purchase price, everything is there. So let's just scroll down. We are still on it. Let's go down. We have download center. Download center. Okay, maybe we have some things here, maybe a content that we've already put here, and then we just want to okay, let us download all the variables or the details of what we've already put here. You can easily download it from here. So let's go forward. We have certificates. So certificates. So people come to the hospital for birth certificates, and then a patient do have ID, staff do have ID card. So let's click it and see how it is. So we have it here. Look at all the necessary things, all the necessary parameters that are here. You understand? We have to just create according to each hospital, specific. This hospital design might be different from because each hospital has their own logo. So patient ID 2, ID card. We have patient ID card section where we can input all the names of the patient, and then we can easily click and then download their ID card and print it out for them. So staff ID, the same thing, and then the front CMS, content management system front end. We might say, okay, all right, immediately we open the application, we want the front to look like this, or basically, but we may not necessarily need that, because the operational environment, that's what we are working with. So live consultation, actually we can configure live consultation whereby you can reference with a person in a remote area, and then you can consult and then you discuss together. If this application is deployed online. Locally, if it's local, you can only send text and chats in between one person or the other. So we have that feature there, live meeting. We have that feature there for live meeting, Zoom meeting, and every other thing. We can just configure the API here, and then it will automatically connect. And then you can easily have meeting with a client or a patient or any other person. So we have various reports, report section. So look at the report, daily transaction report. We can download it. All transaction report, appointment report, OPD report, IPD report. We can download it, or we can get those reports on daily basis or monthly basis. OPD balance report, IPD balance report, OPD discharge patient, IPD discharge patient, pharmacy bill report, expiring medicine report, because we have to take cognizance of the medicine that is expiring, so that we will not give or administer such medicine to the patient. So that one is very significant. We have pathology patient report, radiology patient report, OT report. We have blood issue report. We have component issue report, blood donor report, live consultation report. So all the details of what is going on, all the activities going on this application is being recorded automatically. Live meeting report, TPA report, income group report, expense group report, ambulance report, birth report, death report, payroll month report, payroll report, staff attendance report, user log and patient login credential. We have email and SMS log, inventory stock report, inventory item report, inventory issue report, audit tray. Audit trays is used to measure all the necessary communication, live communication, transaction that is done. You now balance it up so that you'll be able to know each of the officials or the staffs, what they've done or what transpired over time through the application. So now you'll be able to measure all their let me just say performances. So now patient visit reports, patient bill reports, referral reports. So now let's go to the setup. We have the setting where we can put all the necessary information about the hospital, upload the logo and every other thing. We have so many, so we may not go into details. So just for us to see this. So now let's scroll down. We have so many. We have patients where we can include patient name, patient details and everything. As you can see, we have already patients in here. So all the details of the patients, you understand, we have them. And then we can still scroll down. We have so many of them. Bed, hospital charge. This is where we set up the hospital charge. We have hospital charge category. We can click chart categories, see it, chart type, everything. We can do all the settings there. Tax category, unit type, and every other thing. So what else again? Then bed. We have different kind of bed status, bed type. We have bed type, bed group, everything. It depends on each of the hospital. So we have the floor floor, and more. So we still have, if you want to print either, okay, we have operations, let me click operation, different kind of operations. It depends on individual hospital, actually. Like this, we have operation category, arthroscopic surgery, including ACL repair. The category is ENT, you understand, and oral surgery. So we have bronchoscopy, which is like tracheal surgery. So thoracic surgery. So we have pharmacy. You know, pharmacy deals with drugs and every other thing. So we have different kind of drugs. That one depends. We have supplier, we have medicine setup, where dosage setup, dose interval, and dose duration for each of the medicine. So it's into detail. So we have pathology. We have pathology, clinical microbiome. For pathology categories, we have a lot of categories depending on you, on the hospital. So that's what we have now. And then radiology. We have radiology, we have blood bank setup, we have symptom setup, we have finding Zoom setup, finance setup, human resources setup, referral setup, appointment setup, inventory. So those are the things that we have. So as for now, we call it a day, and have a wonderful day. So I can finally log out as a super admin, and we can create different level of access for each of the users. The doctors would say the medical, the MD of the hospital, say the admin, say the receptionist, say the nurse, and so on and so forth. So they have different level of view and different level of asset. So this is super admin, where we set up everything. So have a wonderful day. Thank you. I'm logging out.